I'm Dr. Michael Yunaev. I'm a Sydney-based oncoplastic breast, general and cosmetic surgeon. I'm also a principal surgeon at Breast and Body Clinic. We have a number of clinics across Sydney and New South Wales and would love to see you here. Breast implant revisions is a common procedure which is performed for many different reasons. There is a great uptake of breast surgery, particularly breast augmentation surgery across Australia. Many patients are having this done on a daily basis. However, what this means is that there is now a significant increase in the number of patients who are having to have revision surgery as well. Sometimes there's nothing wrong with the surgery, but the breast implants that have been used have come to their use-by date. A less common scenario is where a patient is not happy. They may have gone to a particular clinic and perhaps have had a surgery, but the results they were expecting is not what they got. Another group of patients that are having revision surgery are the ones that have actual complications from their surgery or from the implants that were used in surgery. Potential complications that can occur with implants include, but are not limited to, most commonly contractures. This is where you see a capsule, which is basically a fibrous tissue that forms around an implant. This kind of capsule forms around every single implant. However, in certain scenarios, the capsule can become firm or hardened, filled with calcium, and in fact, frankly painful. It can also cause malposition of the implant. Other issues that can arise, of course, infection. Being a prosthetic device, we are super careful in how we insert this into the body to try and avoid infection getting in. But nevertheless, there still is a small percentage of cases where this does happen. Infection itself can lead to contracture, which we've just mentioned, but also to other problems as well. Another common complication is that implants can rupture. So what does that mean? That means that there can be a break in the capsule or in the actual outer shelf of the implant. And so there are two types of ruptures. One is where it is contained within the capsule, which forms naturally around each and every implant. But also there can be what's called an extracapsular rupture. This is where the silicone escapes outside of the capsule and is free to go just about anywhere. So in this setting, I do recommend the patients not to wait too long and think about a revision surgery to avoid other complications such as granulomas and infections associated with this free silicone in their body. So all of these things can be addressed with revision surgery. It can be quite challenging, it can be quite technical, and not always successful on the first go. Certainly there are many patients who see from time to time who've had 1, 2, 3 or 4 revision surgeries and still require problems to be corrected.